So we did your eyebrow, what, 2 months ago? 3 months ago?
It's been almost 3, yeah.
And
I think the 21st or sometime around there will be 3.
yeah, and you look fantastic today.
Thank you.
And let's just get a little closer. So as we were just talking, you know, we put the hair in, we put in more than I thought you and I both needed, and then they all fall out. And the hairs that you've got growing there right now are just a wisp of what's to come. And so, like we were just talking with...
I've cut some already too, actually.
Oh, that's good. With hair into virgin scalp, it takes typically 13 months to get your final result on average. And with hair into scar, it can take 18 months or so. So next Christmas, that's when I kind of like to see you again. I know you're moving out of the area, but send pictures, and if you roll back in for anything, that's when I want to see you. How much did I hurt you when we did all this?
Not much. Maybe the first 2 or 3 days my back of my head was more sore than anything, and I was nervous about accidentally touching this, like at night, you know, flipping your hair out of your face and stuff.
Because I tried to scare you into not touching it, yeah.
Yeah.
Let's look at the back of your head.
That was
Oh, yeah,
so that looks great. Let's just get it closer.
Careful, because I got your hair right here.
So this is what the little stitches, the little scar looks like. This is a couple months out from a modified FUE. That little red dot is one of the dissolvable stitches we just took out. Was working out with 3 little dashes, just like I've drawn pictures of before. A couple little dots from MFUE. We just took a little dissolvable stitch out.
That's a little line right.
Yeah, just went the wood.
That's the little line right there.
And so it's significantly thinner than the wood of this Q-tip.
It is. Oh yeah, way more. See that little? That's the line right there from the cut.
Yep.
Right there.
Yep.
Oh yeah.
Perfect.
It's very minimal.
All right. And you were in a couple of different car wrecks, and so you had...
2, but this one was the only one that did my face like this. The other one broke my nose and gave me a concussion and stuff, but it didn't... This was the bad one.
Yeah. So you've got some scar tissue, and then we'll put some hair on there. This should be easy. So you've got really thin hairs back here. That's the thing you have going for it. It'll be a pretty close match in caliber to your eyebrows. The only difference is, you know, hair back here grows a foot or 2 long, and your eyebrows only grow a centimeter, so you have to trim these. But this will be good hair to work with.
I don't mind trimming.
So now you're all numbed up. Did it hurt much when I numbed you up?
No.
Okay. And don't say the guy's name, but you were just saying that the plastic surgeon you went to said he could do your hair, and you said his assistant was surprised and said that they didn't know he did hair, which is always of concern when people just dabble in something. It'd be like me saying I can do your breast augmentation. Yeah, and I've never done one. I've seen one on TV, so yeah. So we took 3 little modified FUE punches out. Did I hurt you when I did that?
No, not at all.
All right, and there's this will close up and leave just a tiny little dash. A little bit swollen, and we'll get those stitches out next week. 3 little specimens right here. We'll get more than enough hair. And that took maybe 2 minutes to do that?
Yeah, maybe.
Okay, so I drew the contour of your eyebrow, and you can see exactly where that scar is. And remember how we talked about how flat the eyebrow hairs need to lie with respect to your skin. Unlike the hair on your scalp, which I was trying to show, which sticks out of your head at 45 or 50 degrees. This has got to be really flat, and so I'll make the holes in a second. And the ones closest to your nose, kind of aim towards your right temple, and the one as you get over to the side, they're actually aiming kind of down. So there's a change in vector right above your eye. So the key we talked about before is it's got to be with a regular hair transplant, it's an angle like this, but these boys got to lay just really flat. But you have to get it deep enough that the root is underneath the skin. Not hurting you, right?
Not at all. I didn't know you were cutting. I thought you were putting in that injection.
We'll do that after I make the holes.
I can hear it, which is a little gross. Because mentally I get grossed out by things sometimes. But it's okay.
You doing okay?
Maybe I should have mentioned before, this eyebrow has always been a little bit higher looking after the accident.
Oh, you told me that last time. We spent a lot of time talking about
Okay,
that.
so did you put it lower-ish? Like the hairs are going to go lower-ish to bring it down a little, or no?
I got to put it to line it up. Otherwise, it won't line up with the rest of your eyebrow.
Oh, okay. I thought maybe you could put them like a little lower. What I think happened is I think he sewed it up differently, maybe.
Maybe. Or maybe you were crooked before.
Oh, I was not. I have pictures.
Well, you take that up with that guy. Okay, so because you have such fine hair, we're going to put a little PRFM in there, which ought to pull in some growth factors, particularly in that scar tissue, and give you a little bit better safety margin. Not hurting, right?
No, I don't feel it much. Just
oh,
movement. It
yeah.
doesn't hurt at all.
And although you and I talked, I'm very scared of putting anything particulate around the eyes. This is your own tissue, and there's no particles yet, although it'll congeal pretty quickly. So there's really no risk of...
Is that good?
They going in good?
Yes.
I
So
think
there's only,
Christian
like,
men might be a little
3?
better, but
There's like 2 here that are not deep enough, but I'll do it at the end.
Okay.
Okay?
Is this hurt at all?
I feel a little bit of fluid in my eye. I don't know what it is, but no, the
It's
procedure
saline.
didn't hurt.
Yeah, it's just, we just washed off some
Yeah, I have to.
doctor and water. Yeah,
No, I didn't feel it at all.
great. Any pain so far?
No, not
Pretty
at all.
straightforward?
Yeah,
Yeah.
super
And you
easy.
got them down in there good.
And Wendy's lots of fun to talk to.
Yeah, she's something all right. Okay, so we're all done. How much did it hurt you today?
None, except for the injections.
Yeah.
But that's not bad either.
Good. All right, so those hairs are barely in there. I mean, just barely. You touch them, and they're coming right out. So you just can't touch it till tomorrow. Okay.
But tomorrow they'll be a little more anchored.
Oh, yeah,
Yeah.
they'll be anchored pretty well. We'll show you how to clean it tomorrow.
So I should keep away from my kids. Like, don't
Let anybody...
Yes, nothing.
don't even wash it.
No.
Nothing. Just show up here tomorrow, and we'll take care of the rest of it. This is your first day out. How much pain did you have last night?
No, like not very much. Maybe like a 3 in the back of the head, but the eyebrow didn't hurt at all.
That looks perfect. I'm just going to show the back of your head here.
It was just tiny bit sore, and it was maybe tiny bit uncomfortable, but
Let me just hold up your hair back here.
I really didn't need pain medicine. I just wanted to make sure I could sleep.
Oh, sure. There's your stitches. I just had to find them. Just 2 little stitches right underneath here. So just clean them in the shower. That's all you need to do. So you are 9 days out from us doing this little modified FU, right?
Yes, I think so.
Did it hurt a whole lot or not too much? You were just complaining about the stitches poking a little bit.
No, they were itching.
Okay.
But no, in the evening, at bedtime, maybe for like 3 or 4 days, it was a little sore. But I took the pain medicine.
And that's what it's supposed to look like. You can go ahead and put whatever that type of makeup is that sticks to your eyebrow hairs. You're welcome to put that on there like you were doing before. It would be difficult for you to screw this up at this point.
Even though it's not fell off yet?
Right? Well, it's going to grow for a couple weeks and then it'll fall out.